On this Monday night, situation critical at an Ontario nursing home. 9 people die as the virus sweeps through a care home.
Our worst nightmare and possibly beyond that came true.
Plus, an entire community in Quebec now under quarantine. Payroll plan, new details on the massive wage subsidy for businesses and charities. Stranded and sick at sea. Where will 2 cruise ships carrying Canadians be allowed to dock? Staggering numbers in New York as a makeshift hospital goes up in Central Park.
We've been behind this virus from day one.
Can Canada avoid the same crisis? And ethical dilemma. If there are too many patients and too few ventilators, who gets treated first?
Global National with Donna Friesen.
Good evening and thanks for joining us. 9 weeks after the first confirmed case of COVID-19 in Canada, and this country has reached a critical moment. Now is the time we begin to find out how much the physical distancing and self-isolation we're doing is slowing the spread of the virus. There are signs in some places it is beginning to work. And tonight, there's another example of what happens when the virus spreads through a care home. 9 people connected to a long-term care home in Bobcaygeon, Ontario have died. That's according to the home's medical director. 24 staff have tested positive. It is the biggest outbreak in Ontario. Care home residents and the staff they rely on are among the most vulnerable. The facilities are often understaffed. People work in more than one home and few have personal protection equipment. Ontario has the most deaths in the country now, 33. And it has strict new advice tonight for anyone over the age of 70 or who has underlying health conditions. Stay home and self-isolate. That means don't leave the house at all. Abigail Bimman reports on the toll this virus is taking on a small-town care home.
We're all shedding tears.
Pinecrest Nursing Home's medical director describes it as a war zone. She says 9 people have died of COVID-19 and at least 35 residents are sick. There's 65 beds in the home.
Our worst nightmare and possibly beyond that came true.
Residents' family members like Lindsay Bleers can only wait at home, hoping for the best.
Wishing we could have those times, wishing I could just go in there, but unfortunately they're not even allowed to leave their room, so it's scary, it's sad.
We're putting an iron ring of protection around our seniors, especially those in long-term care and retirement homes.
There's no agency putting out information on care homes, no coordinated way to get a picture of what's inside. Stories like Pinecrest emerging through the media. The Ontario Premier's Iron Ring is $243 million to protect residents through more screening and cleaning and increased capacity. The province saw its biggest daily increase in cases overall. Doug Ford is now asking anyone over 70 and those who are immunocompromised to self-isolate and warns everyone else to physically distance.
We're prepared to take further action if we do not see the spread of this virus slow down in the coming days.
This is a really critical week in our fight against the coronavirus.
Ottawa stressing what happens in the next few weeks is so dependent on how people behave today, especially all those returning snowbirds and vacationers legally required to self-isolate.
Head directly home, do not stop for groceries or other essential supplies. Pick up the phone, get online and order what you need.
The Deputy Prime Minister acknowledges all these things aren't easy. Seniors trying to figure out online grocery orders, physical distancing, people having trouble reaching Service Canada by phone. But while Krista Freeland apologizes for the system kinks, she's very clear that all these measures are, quote, what we have to do. Abigail Bimman, Global News, Ottawa.
Here are the big picture numbers in Canada. At least 7,400 people have now tested positive for COVID-19 across the country. That's roughly 3% of the 220,000 people who have been tested so far. It's not a complete picture of how many are infected, though, because we know not everyone with symptoms is getting tested. Of those who are confirmed positive, about 7% are in the hospital, 3% are in critical condition, and about 1% of people who have tested positive have died. About half the confirmed cases in Canada are in Quebec. Close to 600 new cases were confirmed today alone, and that brings the total in Quebec to more than 3,400. There are clusters of outbreaks in several regions, and for the first time in Canada, an entire community has been put into quarantine. Mike Armstrong reports.
An entire Hasidic community north of Montreal is now officially quarantined. Aside from essential services, no one is allowed in or out. About 3,500 people have been ordered not to go anywhere.
It's quite an intervention. It's maybe the most difficult decision in my life, about what we do now.
Health officials tested about 80 people in the community last week. Not even half the results are back, but they already have 15 positives. All people who recently traveled to the U.S. Travel is still an issue in Quebec. Police have set up roadblocks at main entry points into the province, telling people they have to self-isolate for 2 weeks. The province also has checkpoints around some hotspots and is limiting access to northern parts of Quebec. Denser areas have been hit harder. One major cluster is in Montreal's West End. People not from the area are being told to stay away. The local mayor says the community skews older and is predominantly Jewish, two factors that likely played a role in the outbreak.
Well, it was expected because we have a lot of snowbirds that returned to our city in the last few weeks, and we also had a lot of celebrations.
There isn't one specific reason Quebec's been so badly hit. There are several. Travel corridors are a factor. There are a lot of links to New York City. But another factor the Premier points to is the calendar. Most provinces hold spring break in mid or late March, and they were canceled over COVID-19. Well, Quebec's spring break was the first week of March. Families went on vacation not knowing there was a threat. In fact, the week after, there were 4 days where everyone went back to school and work. Things didn't start shutting down until the 13th.
We're facing a long and tough battle.
Quebec's premier says the rate of testing also boosts the numbers. It's testing 808 people per 100,000 residents. The average in the other provinces is 558. Mike Armstrong, Global News, Montreal.
We got more details today on the federal plan to keep businesses afloat. The wage subsidy will be available to all companies, no matter how many employees they have, if they've had a 30% or more drop in revenue because of the pandemic. The government will cover 75% of workers' wages on the first $58,000 of salary, which could mean payments of up to $847 a week. The subsidy will be available to eligible businesses, nonprofit groups, and charities as well, no matter how many people they employ. And the Prime Minister had a stern warning for any employers who might try to exploit the wage subsidy.
We are trusting you to do the right thing. If you have the means to pay the remaining 25% that's not covered by the subsidy, please do so. And if you think this is a system you can take advantage of or game, don't. There will be serious consequences for those who do.
The wage subsidy is massive. Nothing like it has been done in Canada before, and it's been welcomed across the board from business and political leaders, no matter their political stripe. This pandemic is testing our political leaders like never before. Today, Ontario's Premier Doug Ford made a point of praising the federal response, especially the efforts of Deputy Prime Minister Chrystia Freeland.
She's an absolute champion. You know, I talk to her every single day, and anything that we need, and vice versa. We work very, very well together. We're on the same team. We're on Team Canada. This is how we're going to defeat and beat COVID-19, by all working together.
2 cruise ships with nearly 250 Canadians on board are on their way to Florida tonight after going through the Panama Canal, but it's not at all clear where they'll be able to dock. On the Zaandam, 4 people died and nearly 200 others have flu-like symptoms. Almost 800 passengers without symptoms were transferred to the sister ship, the Rotterdam. Both ships have been turned away by several Latin American countries, and today, Florida's governor said he wants the cruise ship company to dispatch medical personnel to the infected ship rather than make the state's scarce hospital beds available to any passengers. The situation in Florida is bad, but the epicenter of this U.S. outbreak is New York. This Navy hospital ship arrived in New York City Harbor today. It has 1,000 beds on board and will be used as overflow for people who are not infected with COVID-19 but need hospital care. The Comfort Navy ship also has 12 operating rooms that could be up and running within 24 hours. There's a desperate shortage of beds and equipment, and not just in New York. Jackson Proskow reports.
Body. New York's hospitals are running out of room for the living and the dead.
This is for real, y'all.
In Brooklyn, a forklift loaded bodies into a refrigerated truck. The hospital morgue is filled to capacity. In some emergency rooms, plastic sheets are used to separate infected patients, as doctors and nurses struggle with a shortage of protective equipment for themselves.
We are seeing a lot of younger patients that are coming through the door that are sicker as well, and that is surprising and a little scary.
In iconic Central Park, a field hospital is under construction, while at the convention center, thousands of temporary beds await their first patients. COVID-19 has killed more than 250 people in New York State in just 24 hours.
There is no American who is immune to this virus. I don't care if you live in Kansas. I don't care if you live in Texas.
New York is days away from running out of ventilators. Louisiana only has enough to last for another week. America's public health officials now warn that even the most optimistic scenario is bleak.
If we do things together well, almost perfectly, we could get in the range of 100,000 to 200,000 fatalities.
Experts say the response has been far from perfect.
It's not consistent, it's not uniform across the country, and there are still a lot of people who are not taking this seriously.
In Florida, where case numbers have begun to surge, the governor signed an order urging people to stay home, but only in part of the state, while Virginia neared a complete lockdown that won't expire until mid-June.
If we don't do everything we can now, we're going to look back and wonder how many more lives we could have saved.
In the rush to get medical supplies, there's a new wrinkle. States find themselves bidding against each other and the federal government and private hospitals, all with single suppliers. That's resulting in higher prices at the worst possible time. Donna?
There's such a scarce resource right now. Jackson, thank you. There's more alarming news out of Washington state tonight. At least 45 members of a choir have been diagnosed with COVID-19. About 60 members of the Skagit Valley Choral Group went to rehearsal on March 6th. 3 weeks later, the majority of those who were there have tested positive, and 2 people have died. There's been a lot of mixed messaging about masks, who should wear them, and how much they really protect you. Austria, for example, is making it compulsory to wear them in supermarkets. Austrian grocery stores will start handing out free masks at entrances, though they are not medical-grade masks. The World Health Organization and Canada's public health officers say wearing masks in public to protect yourself is not necessary. You should be keeping your physical distance from others and washing your hands. Plus, we need to be careful not to waste masks. They should be saved for frontline responders who have direct contact with sick people. Also, if you have any symptoms, you have no business being out in public, mask or no mask. Prince Charles, who tested positive for COVID-19, is now out of self-isolation. The 71-year-old had only mild symptoms and spent 7 days at the royal family's Balmoral estate in Scotland. And the planned date for Tokyo's delayed Summer Olympics has now been revealed. The opening ceremony is now planned for July 23rd, 2021, almost exactly a year after the original date. The Paralympics will begin, if this is all over, on August 24th. The life and death dilemma for doctors. Coming up, what happens if you have too many patients and not enough ventilators? We know that doctors in places like Italy and New York have had to make some heartbreaking decisions about who lives and who dies. It hasn't come to that in Canada. But as Heather Urich's West reports, ethics committees across the country are now helping frontline workers prepare for some difficult choices.
There is a reason that ventilators are also referred to as life support. Critically ill patients need them to survive. And with COVID-19, doctors are learning that the sooner patients are put on ventilation, the better their chance for recovery.
As more people have been entering hospital, we are seeing an increase in people going into ICU and being put on a ventilator sooner rather than later, because that seems to improve the outcomes.
But what happens if hospital resources are overwhelmed and there are simply not enough ventilators to go around? Hospitals in Canada are now preparing for those difficult decisions that may come if what's happened in Italy or New York were to happen here.
We're looking at trying to save as many lives as we can, as opposed to a particular life.
Dr. Timothy Christie is a medical ethicist who is part of an ethics committee in New Brunswick. Similar committees have been struck across the country to help guide physicians through the weeks ahead.
If there's a competition, say, where more than one person needs a particular thing like invasive mechanical ventilation, we would want to give it to the people with the best outcomes.
In Italy, doctors consider a patient's age, pre-existing medical conditions, even whether they have family to help them recover before deciding whether those patients will get a coveted ICU spot. In some U.S. states, intellectual disabilities are also considered.
I feel very strongly on this from a professional point of view, that we cannot do this in Canadian society.
Instead, ethicist Carrie Bowman believes priorities should be based solely on whether that patient is likely to recover, which may mean withdrawing life support earlier from patients who just aren't getting better.
That are not progressing and the ventilator is needed. That is going to be profoundly tough.
Tough decisions that may be needed to save the most lives as this virus spreads. Heather Urix West, Global News, Calgary.
Still ahead, could what's happening in New York happen in Canada's largest city? We're all watching closely what's happening in the United States next door to us. It's now the epicenter of the global COVID-19 pandemic, and it's hitting close to home for a lot of Canadians. In Toronto, this country's biggest city, there are now nearly 600 cases. That's still a fraction of what New York City is dealing with, but the two cities are often compared as financial and cultural hubs. So is it possible Toronto could be at the same kind of risk? Jeff Semple went to find out.
New York City's healthcare workers have endured hurricanes and 9/11, but say they've never encountered a threat like this.
We're fighting for your lives, but we also fighting for our lives too. We are also scared.
The epicenter of the U.S. outbreak is watching its COVID-19 cases soar and supplies run out.
I need eyewear and I need face masks. I need as many as you can get.
And for many Canadians, these scenes are hitting too close to home.
This is right across the border. And, sadly, if it can happen there, it can happen anywhere.
But so far, the outbreak is unfolding much differently here, in part because it's easier to keep your distance.
New York City averages more than 10,000 people per square kilometer. That's twice as many as the city of Toronto. In fact, Vancouver tops Canada's list when it comes to population density, but is still nowhere close to the most crowded community in the United States, Manhattan, home to more than 25,000 people per square kilometer.
As the more denser cities you have, the more human interaction you have. The more people go to the grocery stores, meet in elevators, small places. There's a lot more entertainment options. So that all these factors enhance the spread.
And in New York, that problem is compounded by healthcare accessibility and poverty. But population density doesn't necessarily determine destiny. Seoul is twice as crowded as New York, but South Korea has had far more success curtailing the contagion. In part, experts say, because they tested early and often, and so too did Canada.
We had a better ability to test people. It wasn't perfect, but it was better than what was happening in many parts of the state.
And the result is plain to see. The number of confirmed cases in Ontario compared to New York State. But experts warn our actions this week could make the difference.
It really is up to us whether or not we want to take the path of New York City.
Jeff Semple, Global News, Toronto.
Next, how where you live affects how physically distant you can be. Keeping physically distant isn't how most humans are wired. We're social beings by nature. Now we're all being forced into this weird but essential new reality, staying apart but trying to stick together. As Eric Sorensen reports, where you live can make a big difference.
For just a moment here and there, it looks normal. But then you realize most people close together are partners or family, a household bubble out for a walk.
We're pretty much separating the household is separated from everyone else.
And everyone else is increasingly keeping their distance. Mary Jo Anderson stays near her husband, and that's it.
You're definitely able to distance yourself when you're walking. I notice even for this interview, we're very distant.
Physical distance is the new reality, but from above you see its experience differently. In rural Canada, working at home, seeing only family can be a normal day. And where people have homes close together, even then there is space and backyards. The biggest adjustment may be downtown living, where thousands of people are stacked on top of one another. Think about elevators.
You have to be very careful about, so, press the button like with your elbow.
In a 30-story building, you can't help but converge on strangers sometimes.
And I just look at people and I'm like, you're a hotbed of germs, so I'm going to keep my distance.
There is something unnerving being in a big city and not bumping into people. Amidst the glass and concrete canyons, the usual attractions from theaters to big league sports, all the reasons to cluster downtown have vanished.
Why did I choose to live in a city? Because I love the people. I miss that the Ripley's and AGO and all of the great parts that make this city wonderful have to be closed down. It's hard. For us social beings, it's hard, right?
There is some advantage in big towns or small when where you live has space. Lisa Forte, with her dog Grace, sees that.
We're fortunate we're in a home in a small cul-de-sac, so we have a small yard, but it still is large enough for her to go out and for me to sit outside and putter around a little bit.
Still, it's an adjustment for everyone, so it's chin up downtown.
We're all adjusting to it at the same time. We are very much in this together, and there's a small comfort and hope in doing that.
And apart from your tight circle, keep your distance wherever you are.
We're not walking arm in arm any longer. No, just emotionally we walk arm in arm. Physically, we keep a little distance.
Eric Sorensen, Global News, Toronto.
And that is Global National for this Monday. I'm Donna Friesen. We want to thank all of you again who have to go out to work, the essential workers and everything from hospitals to grocery stores. We couldn't survive without you. And finally, we know people were panic buying toilet paper. Now it's puzzles. Apparently they're being snapped up online. So much so there's a shortage of them. Looks like lots of people are puzzling their way through this pandemic. Thanks for watching and take care of yourselves. Bye-bye.